All right, now we're going to start on epidemiology, and we've kind of covered this a little bit. If you recall, we talked a little bit about John Snow and how he talked to people to figure out where the disease was infecting people or how it was infecting people and then where. But now we're going to talk a little bit more specific. There's entire courses. Actually, there's an entire master's program in epidemiology. So we're really just going to kind of touch the surface, but that's what we're going to do. Okay, come on, slides. By this word. All right, so what is epidemiology? Epidemiology is the study of the distribution and determinants of health-related states among specified populations and the application of that study to the control of health problems. That's a long sentence. Good grief. But, it's hard to define this. So let's take it step by, what the heck? Let's take the step by step. So the first part, study of the distribution and determinants of health-related states. So basically, where is it occurring? That's distribution. And what's causing it? That's the determinants. And the next part is among specified populations. So not everyone, it's just a certain group of people, or, in case of a pandemic, obviously it could be everyone, but at any rate, and then the application of that study to the control of health problems. So basically just using what you learn to make health better. Okay, I'm sorry. Okay, so what are the purposes of epidemiology? Well, we want to discover the agent, the host, and the environmental factors that are going to affect my health, your health, the world's health. And then we want to know what the importance of these diseases are, and like, do they cause death? Do they cause illness? Do they cause disability, etc.? And then we want to ID those people who are at risk for it. And finally, we want to evaluate how effective anything we put into place to help treat these people or to prevent this is. So the first one, what is the problem? This is surveillance. Okay, so we're just kind of looking at what's going on. The second one is risk factor identification. So, kind of what is the cause? So we're just going to talk about COVID. People got sick and they had a respiratory illness. And then they figured out what it was. And then the government had some interventions. And that was, they told people to mask, or they told them to get vaccines, or both. And then they looked at what worked and what didn't. And then they implemented it. They spread it across the United States and said, these are our recommendations. Okay, so you can see that we go from problem all the way over to response in epidemiology. All right, so this is a 4-step scientific approach. So, sorry, step 1 is the surveillance. We want to determine the time, the place, and the person. Okay. Step 2 is the inference. So that means we're making a determination. Okay, we think that COVID is a respiratory disease, or we think it's a bacterial disease, or we think it's people are breathing something in the environment. So just making an inference about the disease state. Then we investigate how and why. And so then finally we have the intervention. Okay, where was I? Intervention. What is with my computer today? Sorry. All right, so let's go over some key terms. You probably already know these, but let's just make sure, okay? So epidemiology key terms. One is an epidemic or an outbreak. So that's when a disease occurs in a population that is higher above normal. So, like pretty soon we're going to have an outbreak of influenza. It always hits California, Sacramento area, usually December, January, a little bit into February. Hits the East Coast a little earlier, so they have an outbreak more like November. Then we also have what's called a cluster, and that's a group of cases in a specific time and place that might be more than expected. So that's not like an outbreak where there's a lot of people. It's just like, okay, 3 people got food poisoning from, in this one city, or maybe 10 people. And where did they all get it? They're not family, they're not sharing it. It looks like it's bacterial. All right, then there's endemic, which is a disease or a condition that's present in a population always. And that's kind of where we're at with COVID now. It's kind of endemic. So there are continuing cases. We're hoping we don't get a new variant and have an epidemic, but it's just going to probably stick around, kind of like the flu. And hopefully scientists will be able to create a vaccine for each fall or each winter or whenever it, is going to typically occur. Then a pandemic, that's when a disease spreads not only across one specific area or a given population, but it goes worldwide, or at least other regions. So it might be North America, South America, and Hawaii. Okay. And that would be, that could be a pandemic. It's not in Germany, it's not in Spain, whatever, but it is, in a large geographic area, more so than just a smaller epidemic. Okay, and then rate. Rate is an important term in epidemiology because that's the number of cases in a specific period, but dependent on the population. So it's like percentage, if you think of that. So if there's 5 people sick and there's 10 people ill, the rate would be 50%, right? If there's 20 people sick and there's 100 people in your population, then that would be 20%. Okay, so I think that makes sense, I hope. All right, so how do we calculate rates? Well, the simplest example is what I just showed you. But in epidemiology, we can't just compare the number of cases. We have to also compare rates. And that gives us information regarding what it says here, compare health problems among different populations that include 2 or more different groups. All right. So we might compare people who had eaten at a restaurant and those who didn't, and look for cases of foodborne illness. Or we might compare men with women who who does more driving under the influence. Okay, so population variables can vary by lots of different things: gender, ethnicity, living near an airport, drinking from a specific water supply, as was the case with cholera, vaccinated or not, do you get COVID? So here's 2 different populations that we can compare. Okay. All right, so let me go back. So by comparing population characteristics, we can see more clearly what might be associated with this negative health event or disease. And then we can determine what actions to take. All right, so rates can also help us compare a baseline rate of disease or condition with a current event, such as whether there's a spike or a decline. Okay, so looking at this to calculate a rate, we're going to take the number of cases and we're going to divide it by the number in the population at risk and multiply by 100, and that's going to give us that percentage. All right, so then we know what the frequency of the disease is. Sorry, I'm moving ahead too fast. After the frequency is identified, the illness rate is calculated. Oh, wait a minute, I went over that. So sorry. Let's look at an example of how the rates were calculated in an actual case of unexplained pneumonia. You're probably all too young to remember this, but I was, I think, a college freshman, or I don't know, maybe a college senior. But anyway, a bunch of people got sick at a American Legionnaires conference in Philadelphia. Okay, so let's see what happens. Okay, so there's an American Legion convention in Philadelphia, July 21st and 24th. Okay, then in a short time afterwards, there were 18 deaths reported among the conventioneers. Now, if you go to a convention, you don't expect 18 people to die immediately following that. I mean, unless there was a bus accident or something. So something's going on here. All right, so then a healthcare provider at the Veterans Hospital in Philly called the CDC to report these cases. Okay, that was August 2nd. By the end of the evening of that night, there were another 71 cases, additional cases that were reported. Okay, so where did they find these cases? Well, they were from hospitals, they were from doctors' offices, they were from urgent cares, whatever. And when a physician has something, well, physicians are required to report a number of things. And typically influenza is one. And because this was influenza-like or pneumonia-like happening in the middle of summer, that's not common. And then also because there was such a cluster, doctors started reporting it to the CDC or to their local public health departments. Okay. And then what happened then is that the CDC started contacting other hospitals and other healthcare facilities and said, if you have any more cases of this, let us know. Okay, so epidemiologists decided they needed to get to work. So what they did is they looked at 2 different hotels. Okay, so first of all, they looked at the age, which we can see on the left-hand side, 39 and 40 to 49, all the way up to 70, and then a few that were unknown. And we can say, okay, how many of that group were sick? Okay, so looking at this, it looks like there were 27, which was the most that got sick. But then if we go ahead and we look at the total, you know, there's a lot, and there's a lot in the 50 to 59 and a lot in the 60 to 69. So let's look at the rate for each of those age groups. Okay. Each of those age groups we can see on the right-hand side, and we can see that the percentage or the rate is higher among the 70-year-olds. Okay, so just because it was higher among the 59 to 69s, that doesn't mean that they were more susceptible. In this case, by calculating rate, we can see that there was just a larger population of those numbers of people, and their incidence was lower actually than people who were 70 and older. All right, so here's the timeline. Hotel A, we can see the number of residents there. Sorry. Okay, so from the July 21st to 24th, 1976. Okay, so yeah, I was a freshman in college. So again, we're going to look at this. We're going to see the same chart, Hotel A, 3, 9, 27, 12, 11 who were sick. We look at the totals again, and then we look at the rate, just like our last chart. Okay, we can see that 320 is the most, that's the highest number. Hotel A in 50 to 59-year-olds. Okay, but then when we look at the rate, just as I said, 20.4% of 70-year-olds or greater than 70 were at the highest risk. So that's Hotel A. All right, so let's look at epidemiology approach and methods. So epidemiology, I know I'm kind of breaking this up here, but we're going to go back to Legionnaire's disease, but I need you to understand the types of studies that were done in order to solve that problem. So hang on. All right, so the CDC knew they had to come in and they had to design a study and they had to figure out what was going on. They knew there were sick people. They had a little bit of data. They knew that there was a lot of people that were susceptible in the older than 70 age group. All right, so experimental study types. So there is experimental and there's observational. So an experimental is basically you're going to do an experiment. You're going to say, okay, you sit in this room, you sit in this room, and let's put some fumes in here and see if one gets a headache and one doesn't, or if nobody gets a headache. Okay, so that's just doing an experiment. But then we have descriptive and analytical epidemiology, which are part of observational studies. Okay, this is an observational study, and that's the type that was conducted at the Legionnaire's conference. All right, so descriptive and epidemiology, when was the population affected? And where was the population infected? And who was affected? So you're just describing basically these who, what, when, where, and how, etc. Analytical, we also say, how was the population affected? Did one get a temperature? Did one get the disease? Did one die? And then we also ask, why was this population affected? Was there an environmental reason? Was there, you know, something in the air? Was there something in the food? Whatever. Okay, so let's look at a different study now. This one's just going to give us a little bit of info. In 1982, there was a lot of farm-associated deaths, tractor deaths, and so it was decided that it would be studied. All right, so they started doing surveying, and they looked at it, and they first said, okay, when is this occurring? So if you look at this graph, you can see that the most occurrences of farm tractor deaths occurred between 4 and 5. And then the next most populous time was between 11 and 12. So what does that tell us? Well, We don't know for sure. We just know that that's when those particular times were dangerous. Okay. And then the lowest time that any deaths occurred, if we're thinking logically that a farm day is going to end by 7 o'clock or maybe 9 o'clock at the very latest, the noon hour was the lowest. Okay, so we're not gonna go all the way up until, you know, if you're driving after 10 o'clock at night, I think you're taking a risk. Okay, so then we're going to look at the age groups. Okay, so what are the age groups? The highest age group that suffered fatalities was the 60 to 69-year-olds. So maybe it has something to do with age. Maybe they've forgotten how to drive. But anyway, that's observation. And you're just looking at data and what can we do with it then? Okay. All right. So now that we have, we're talking about data and collecting data. So where do we get that information? In the last, we had a survey of farmers or a survey of death reports, perhaps in a county. But a number of ways exist. So the first would be there's a source of an individual person. You might give them a questionnaire, you might have them take a survey. Okay. An example we can see is health data on United States residents, like how many grams of sugar do you eat a day? Something like that. We can also look at the environment. We can take samples from the environment, whether it's water or soil or anything else. And you might remember in Flint, Michigan, a lot of people were getting lead poisoning. And so they checked the water, and lo and behold, there was tons of lead in the water in Flint, Michigan. Then we can also check with healthcare providers. We can say, have you seen any of these types of cases in the last 6 months? Or to say, if you see any of these kinds of cases, report them to us. Excuse me. And then there's also non-health related sources. So in this case, here's a couple of examples. Cigarette sales. So we can look at sales records to find out, okay, how many people are buying cigarettes and how many are they buying? Court records, how many DUIs are being handed out, and are they men or are they women? Are they under 18? Are they over 21? Are they 70 to 90? You know, just all kinds of things that you can ask from the data. All right. And so these studies are conducted to try and discover what the associations are between a risk factor and a health outcome. So for instance, smoking, you know, if you smoke, are you likely to get lung disease or heart disease? Yes, you are. And that's been proven. But before, you know, back when my aunts and uncles and grandparents, whatever, smoked, they had no clue. They just knew that they smoked, and that was fine. But then by looking at the population of who smoked and who didn't, they could tell people who smoked are the ones that are getting lung cancer, they're getting heart disease, they're getting, you know, other bad outcomes. So obviously we can assign that to cigarette smoking. All right, so we can also do a cross-sectional study. So subjects are selected because they're members of a certain population subset at a certain time. Okay, so let's see. Subjects are categorized on their basis of exposure to one or more factors. Let me go back. So let's give an example of this. Let's just say cannabis. Okay, so cannabis. B is the only group who smokes cannabis. A and C do not smoke cannabis or ingest cannabis of any type. And so scientists want to know who is in more automobile accidents. So they can look at this data and they can say, oh, it looks like A and C are the ones who are in the most accidents. So obviously, or, you know, there is a correlation that cannabis smoking or eating, ingesting does not cause you to prevents you from being in an accident. Now, we don't know that that's true, but that's just an example of how you would use a cohort study to take a look at something. Okay. All right, then we can also have a case control study. And this is where subjects are ID'd as having a disease or a condition, and they're compared with people who don't have that disease or that condition. So in the case of Legionnaire's disease, we're going to look at the people who got pneumonia against the people who did not. Okay. All right. So how do we investigate an outbreak? Sorry, I'm just looking at my notes here. All right. All right, so there are a number of steps to investigate any kind of an outbreak. First, we have to establish that there is an outbreak. So, you know, if you have one case of food poisoning at a restaurant in 2 months, that's probably not an outbreak, okay? Even though the person who gets it feels like that's bad, that's an outbreak, but that's not. So then what you need to do after you've just determined, okay, here's the Legionnaires, they're all getting sick. We have to prepare for the field work. So we have to do a little background information. We have to bring in some charts. We have to find the right people. Either we need to do the surveys or we need docs to look at the hospital records. So we need to do a little bit of background prep. And then we're going to go in and we're going to look at, you know, the diagnosis. So how was this diagnosis developed? You know, like what are the symptoms of it? And then we're going to define and identify cases, obviously. And then we're going to use descriptive epidemiology to develop a hypothesis. So in this case, remember we looked at Hotel A and we looked at the age of people and Legionnaires. So we're going to say our hypothesis in this is Legionnaires are getting sick from going to the Legionnaires conference. And it looks like there are a number of people susceptible, but the most susceptible are those over 70. Okay, so that's a hypothesis. And then we have to evaluate it. So we're going to look at all the people and see, were they in Hotel A? Are they over 70? You know, et cetera. And then we'll refine that hypothesis as we get more information. Then we're going to, as one of the final steps, we're going to implement the control and the prevention. And then we're going to report or communicate the findings to either the people that it affects, the general public, the government, whoever is the most logical person that we need to report it to. So those steps, you know, in practice they go in that order, but in the field they don't necessarily go in that order. We might develop a hypothesis first, and then we might do some background work or, you know, whatever. All right. So during step one, we establish the existence of an outbreak, and we might use data from data sources. Okay. Then we're going to prepare for field work, as I mentioned, research the disease, gather supplies, arrange travel, verify the diagnosis. Again, this is repeat. I just covered it. Speak with patients, review laboratory findings and clinical tests, define and ID the cases, establish a case definition by using a standard set of criteria. Okay, so we might say, this disease causes fevers between 100 and 103. It causes a pneumonia. People have difficulty breathing. It causes aches and pains and, you know, fatigue. Okay, so that might be our definition. So we're looking for people with those 4 symptoms or 4 signs. Okay. And then we may use descriptive epidemiology to describe, okay, who was it? It's Legionnaires, and they were at a hotel. They started getting pneumonia. These are their symptoms. It occurred during this time period. All right. So now let's look at, excuse me, at the Legionnaires' actual outbreak. Now that you know about cohort studies and case studies and some of those other things. All right. So if we look at this, we can see that the case peaks between July 25th and 27th, and then the number declines thereafter. Now, remember, the convention was held, started on the 21st and went through the 24th. Okay, so cases began and continued throughout the convention and then continued after the convention ended. Okay. But that's just descriptive analysis. That doesn't tell us anything except that. So now we have to find a little more information. Okay. So this is a table or some tables of people who got sick at different hotels. So everybody stays at a different hotel if it's a large conference. And so in this case, that's what they were doing. All right, so in this case, we can look at the people who are over 70, and we can see the number getting sick were 20% in Hotel A, 6% in Hotel B, and 12% in Hotel C. Okay, then if we look at the totals, in Hotel A. We see there's 688 total. Okay, so now we have to develop a more focused hypothesis. Then we evaluate the hypothesis for validity, and we're going to refine the hypothesis. All right, so 5 months after the first cases of Legionnaires, the results of the case control study indicated that spending time in the lobby of Hotel A was the biggest risk factor for getting the disease. So, that gives us more information. Okay, let's focus in on who those people were that spent time in Hotel A and see if there's any more of them that developed the disease. And what were their symptoms? Were they the same as the other ones, etc.? All right. And then all of this, the sputum from all of these folks was sent to the CDC. They were trying like heck to find a bacterium or a virus or something that was causing it, but they just couldn't find what it was. But finally, there was a lab worker who was studying some of the older samples, and she found that some of the samples that everybody thought were dead were actually still living and growing. And when tested, they resembled other bacteria that was found in water sources. So like warm ponds or heating units or cooling units that have, air circulating that's warm. And so what they did then is they looked at the air conditioning units in Hotel A. Lo and behold, they did find that bacteria, that very slow growing bacteria, that they could then identify as the causal agent of this particular outcome. So then what they needed to do was implement some control measures. So they added chlorine to the air conditioning unit, and they recommended people add chlorine to their air conditioning units at hotels kind of all over, just because this had happened at one. It's very possible it will happen at others. And then the findings needed to be communicated. So who needs the information? How should it be communicated, etc. All right, so that's it for epidemiology. I'm sorry the lecture was a bit jumpy. Just one of those kinds of days. All right, thanks again. Bye-bye.